now my nose starts itching again.
Right, yeah.
Are we doing an hour? How long?
An hour. Yeah, and please do give me a 15-minute warning because in case I haven't.
Right, I'm grabbing my coffee since you're cups here.
Little one, but
Okay,
you
guys.
can see it.
Okay, turn my volume
Live.
Hopefully my,
Hey, good morning. Carol Dixon with the Idaho Federation of Families for Children's Mental Health, and would like to welcome you to our parent webinar series that we have for this month of November. Today we're talking about a really important issue, and I think it's a really complicated issue. I know as a parent dealing with insurance and figuring out what's covered, what's not covered, how much is covered, what your deductible is a little overwhelming. And so in dealing with the families that are part of the YES system of care, it gets even a little more interesting because then you get to look at Medicaid also and what part does that play as the insurance that's covering services for your child. So today we brought together a panel. Janet Pecky is our parent for the Parent Network who is facilitating, and she has a lot of experience and she'll kind of explain what she does professionally and how it ties in. And then we also have from the department, Idaho Department of Insurance and Medicaid and Division of Behavioral Health. Each one of those play an important part. Kids are accessing and services being paid for. So take notes, you might need them. Susie, can they put in questions? Okay, so if you've got questions, you want some clarification on information, we can't answer it right now. We will take some answers back to you. So with that, Janet.
All right, thank you, Carol. Good morning, everyone. My name is Janet Pecky, and as Carol said, I am a member of the Idaho Parent Network. I have been working with the YES system of care for about the last 3 years now, and for my real job, the one I actually get paid for, I do medical billing for pediatric physical speech and occupational therapists. So I have some experience in this area of insurance and the insurance world, and I thought it would be very helpful, all of us did, to bring you some information, just a high-level overview of insurance and how it works, depending on how what kind of insurance you have. And so we've brought with us several folks today to help us understand this. So I'm just going to pass it along. Wes, why don't you introduce yourself and we'll just pass it along.
great. Yeah, happy to. Wes Trexler. I work for the Idaho Department of Insurance and oversee the products that are filed with the Department of Insurance. The Department of Insurance also handles complaints for people who have health insurance and other types of insurance and help resolve those complaints. And I'm involved with some of that process as well.
And I'm Jamie Teeter with the Division of Behavioral Health within the Idaho Department of Health and Welfare. And I work at a statewide level looking at how to implement programs for behavioral health.
Dave Welsh, Division of Medicaid. I've been working on Youth Empowerment Services program for a little over 3 years now. Previously in a role that oversaw the Idaho Behavioral Health Plan contract that Optum manages, and now currently in a role that oversees EPSDT and policy for the Medical Care Bureau at Medicaid. Happy to be here.
Great. Well, thank you all. We're excited to have all of the wealth of information we have at the table today. One of the first things I'd like to just start with is for families who have insurance. And Wes, you handle this. Can you give families just a brief understanding of what their insurance policies entail? Deductibles and co-insurance and out-of-pockets, these types of things. What does it mean for families? I think a lot of people have insurance, but unless you had to access it for a medical reason, you probably don't understand really what all is involved in the coverage.
Sure, yeah, thank you. That's a little bit of a broad question, but I'm happy to give it a try. So I agree, insurance is something that a lot of us may have and we feel we need, and we may not necessarily understand all the details about the intricacies of it until we have to deal with the insurance company and have a claim or thrown into that system. With health insurance, which is, of course, what we're discussing here, most of the time, so in Idaho, more than half of the population here in Idaho are covered under either an employer plan where their employer provides health insurance to them, or they buy an individual health insurance policy. And in both those circumstances, that's essentially called commercial health insurance. And those policies generally have the components that you described, where the insurance will help pay for portions of claims that people have, but the individual that purchases the policy or has the policy is usually responsible for some sort of payment as well. The first component of that is if your plan has a deductible, the individual is responsible for kind of the first dollar of any claims up to that deductible. It could be $500. It could be a couple $1,000s depending on the plan. And there's just a huge variety of how these plans are designed. You really need to look at the documents that your employer provides, or if you purchase it directly, the documents you receive from the insurance company to really understand what is that deductible, because you are responsible for that first dollar up to the amount of the deductible. There's also, as you mentioned, co-insurances or co-pays. Usually those kick in after you've met your deductibles, what that's called. You've paid your deductible amount. Then there's additional co-pays where usually the insurance pays the bulk of it, but you may pay a small amount, such as a $30 copay or whatever the copay of your specific plan may be. And then generally these health insurance plans are required to have kind of a maximum amount that you as an individual are responsible to pay. And after you've hit that amount, after you've paid out that amount, then the insurance policy covers all costs. And that's the maximum out of pocket that a plan has. And so that may be, again, it may be a few $1,000s that once you have some sort of catastrophic claim, the insurance says, well, we do need you to pay those deductibles and co-insurances, but after that, 100% is paid by the insurance company. And that protects you. That's the financial protection that an insurance policy offers.
And that's generally on a calendar year basis, correct?
Exactly right. So deductibles and out-of-pocket maximums usually apply during the calendar year, and then they, what I say is they reset at the end of the year, essentially. At the end of any calendar year, you're going to have to, the next calendar year, again, meet that deductible or pay kind of that first dollar amount, which goes toward your deductible.
So with a deductible and an out-of-pocket maximum, are those combined? So if you had a $5,000 or a $500 deductible and you had a $1,500 out-of-pocket, does that out-of-pocket maximum include your deductible?
So it depends.
It's a very common term in
May hear
insurance.
that
It
insurance.
depends.
But generally, over the last several years, plans have been much more consistent in generally including that deductible and copays. All of that contribute toward an individual meeting their out-of-pocket maximum. So yeah, generally at this point, most insurance policies do include all those components, and you're not having to pay $500 plus $1,500 in your example. All those contribute toward that maximum out-of-pocket of $1,500, if that's the case for that policy.
So in order to meet that $1,500 in this example, they would pay their $500 for their deductible, and then their co-insurance or copay amount until they had reached the total of $1,500, and then for the remainder of the year, their costs for covered services.
For covered services, exactly, are 100% paid by the insurance policy once you've hit that out-of-pocket maximum.
And then once the year resets, your deductible resets, your out-of-pocket resets again. So if a family has questions about whether something is or isn't covered under the policy, where do they look? What document do they go to look
Right.
for?
So it depends a little bit on the type of policy. Again, going back to it depends, but generally, either the employer or the insurance company, depending where you get the policy, is required to provide documents to the individual, the covered individual or the covered family. And in those documents, the policy documents or the certificate of coverage, it will it'll lay out those details as what is the deductible. It'll also have links to, for example, what providers are included, what providers they can go to for coverage. It'll have what the co-insurances are and what the covered benefits are. So it generally will break out hospital coverage. This is the type of hospital coverage your policy has. For doctor visits, this is the type of doctor visits coverage you have. For mental health or for prescription drugs, whatever those are, it needs to lay out each of those benefits. And if you don't have a copy of that, you can always contact your employer, HR, your employer, or you can go to the insurance company directly, and they'll be able to provide you copies of those documents.
So that's basically the family's contract with the insurance company for what is and isn't covered. If it says in there that their hospital is covered at this rate or that this service is covered, that's how you would know before you went to receive a service if it was.
That's right. It's always good to find that document, look at it before you go get service. If you have questions, you can call the insurance company or you can call whoever your employer, talk to the HR people and walk through, is this a covered service or not? For some services, you may need to do that before you get the service. And it's always important to check. if you have something planned, make sure it's a covered service, and also make sure that you have any sort of requirement to get it to request the service before you get it. So all that is laid out in the contract. I'm getting a little into the weeds, and sorry for that.
No,
but,
that's all right. I think ultimately the important thing for families to know is that this summary plan description document, this certificate of coverage, is where you would find what is and isn't covered. And ultimately, it's your responsibility for knowing what your policy says.
Definitely. And I do want to mention that a lot of those documents are required to be filed with the Idaho Department of Insurance. That's something that we do review insurance policies. They have to be filed with us. And if anyone has questions, like I said, you can definitely go to the insurance company. But Idaho Department of Insurance also has resources. We have consumer affairs people who can answer questions especially if you think there's something that should be covered that isn't. That's stuff that we deal with on a regular basis. So we are a resource for consumers.
It's a great place for people to go. And I do encourage families, if you ever do get some kind of a bill that you're not expecting or you don't understand exactly what's going on, this is a great resource for families to be able to go to say, hey, I'm not understanding this about my policy or this about this bill, and can you help me?
Definitely.
It's a great place for them to go. Could you take a minute and explain to families a little bit the difference between in-network versus out-of-network and why that's an important thing for families?
Sure. Yeah, it's and it can make a huge difference. And so thanks for bringing up that topic, because when just about any health insurance policy now has this component to it. It has a selection of doctors and hospitals and facilities that are considered in-network. It's not, you don't just have broad range to go to any doctor or any facility within the state. It is critically important, really, in order to keep your costs affordable, to go to find out what doctors are in-network. And essentially what that means is they have an agreement with the insurance company, and the individual's coverage is going to be better when you go to those in-network doctors. It can be a drastic difference. It can be, for example, the difference between having as you mentioned, a $500 deductible or having a $5,000 deductible. And so if someone really wants to make sure that they get the best coverage and have the least out-of-pocket costs, you need to check before you go to the doctor, or ask the doctor, do you participate in the network for my insurance policy? If they don't, then the cost may end up being dramatically higher.
So one of the things that I know from my billing, and I talk with families about this a lot when we do have, when we are out of network with people, is what's called balance billing when you're out of network. Can you talk about that a little bit and what that means for families?
Yeah. It's a practice that's common, as you mentioned. This happens whenever an individual or there's a claim with a physician or a facility that's out of network. Because there's no contract between the insurance company and that physician or facility, essentially the doctor has an amount that they want to charge, that they value their services at. The insurance company will make some sort of payment, but on that lower reimbursement, the out-of-network. But any amount that the insurance company doesn't pay, essentially the doctor or facility can bill the balance to the individual that received the services. And so it really goes to that, the protections of the insurance policy. You can just end up having a lot more out-of-pocket whenever you go to an out-of-network, not only because the deductible may be higher, but also because the physician will balance bill any amount that's left over that the insurance company did not pay, and that can be a substantial amount.
Well, and that, I think the important thing to note here too, is because of that balance billing, is that if you have, say, in-network, you have 20% co-insurance, but out-of-network, you have 40%. You do have that 40%, which is obviously twice as high as you would have with an in-network provider, but an in-network doctor also has a reduced amount that they've contracted with the insurance company with, but that reduced amount may be the exact same amount they allow out-of-network. So you're paying the 40%, but you're also paying the difference between what they allowed and that whole disallowed portion. So it can end up being a lot more than 40% what you end up paying.
Yeah, no, exactly. So as you mentioned, it'll be what your responsibility is, maybe much more. It could be double, or it depends on every situation is different, but it can be substantially more when you go to an out-of-network physician.
So very, very important to check with your insurance plan and with your doctor to make sure that they are contracted with your particular insurance plan, and reach out. And what happens then say a person went to, they needed maybe psychiatry and there was no in-network provider for them. Does that happen? And if so, what do they do?
Oh, well, I think, we do have a very large state with many people who do live in rural areas that hopefully do have access. But if that were to happen, that sort of situation, the first stop of defense, or the first stop would be to contact the insurance company, explain the situation. Many companies are able to take those types of considerations into effect and work out situations where if there's not a psychiatrist near you or really accessible, they will help guide and may be able to work out something that pointing you in the right direction and maybe figure out a doctor that they will consider in network for your services.
So you'd still have access to that in-network level of benefits, even if that doctor wasn't
Right.
necessarily contracted.
Yeah, and that is something that, again, the Department of Insurance does have conversations with the insurance companies about situations like that. There are state laws and federal laws that do require a certain level of access to the benefits that the insurance company is promising, right? So if they promise access to psychiatrists or whatever the condition may be, and they don't have any of those doctors nearby, that's an issue that needs to be resolved. So talk to the insurance company, talk to HR if it's through your employer, and the Department of Insurance. Again, we can be a resource as well if you just can't, if you're unable to find a doctor that's nearby for a certain type of covered service, as you mentioned. That's something insurance companies do monitor, and generally, if you're upfront with them and contact them, they sometimes are able to help.
Very important information for families. There was one other issue that I wanted to cover with you this morning and make sure we got, which is this whole concept of parity with mental health issues. This is something that's pretty new that's come up in the last several years. Could you just give families kind of an understanding of that?
Definitely. And generally that kicked in for health insurance more broadly in 2014. And from that point, large employer plans, so you get through your employer, and in addition to individual policies, all are required to meet this law called mental health parity. In a summary level, it does is it makes sure that any policy that covers mental health conditions, which the vast majority of policies do, is no more restrictive for those mental health coverage and substance abuse coverage than other types of medical conditions. So if for example, a specialist visit is a $30 copay, mental health parity makes sure that a mental health office visit is also $30 copay. Or if it's 20% coinsurance for any other type of medical condition, it's 20% coinsurance for mental health conditions. Prior to that point, a policy could essentially distinguish and say we're going to cover less of reimburse less for mental health conditions than other types of conditions or other types of medical conditions. The parity really set a standard that they have to be treated equally or in parity. They also are unable to, or the insurance companies are restricted in how they design their policies so that they don't necessarily leave out certain mental health conditions or leave out certain sort of drug treatments for certain mental health conditions. All those types of all that needs to be essentially considered in parity or similar to other types of medical conditions.
Sweet. Well, that's great information for families. Thank you so much for that. We're going to expand over a little bit into Medicaid here and talk with David a little bit. Give Wes a moment to get some water. Seems a little easier to move from topic to topic this way. But anyway, so David, you deal a lot with, well, exclusively actually with Medicaid.
Yes.
So we've done a webinar before on access, but give us a little overview again of families that have children with serious emotional disturbance and what access to Medicaid services looks like for them.
Absolutely. Recently, we've brought up the Youth Empowerment Services program with Medicaid, and we are allowing individuals with incomes up to 300% of the federal poverty level to access Medicaid services. And some of them will have insurance, some of them won't. So some of the things Wes was talking about will be taken into consideration for the purposes of balance billing and how individuals won't be billed for services if they have a primary insurance. But basically what we're bringing up this program, which allows individuals that are under 18 years of age to apply for Medicaid services. And if it is determined that they have a eligible diagnosis and a functional impairment, which in a sense is SED, they will have access to Medicaid services through the Idaho Behavioral Health Plan Network. So we're pretty excited about that. And we've brought a lot of new individuals on who previously were not eligible for Medicaid services. And again, it's a new system and can be very challenging for parents to navigate. And again, that's why we're here today, to hopefully provide some clarity and guidance as to how individuals can navigate that system and get the services that they need for their families.
So then if a family has a child with a serious emotional disturbance and maybe they have private insurance, they are still potentially eligible for Medicaid as well?
Absolutely. So in the instance that whether you have insurance or not, if you think, and you do not have Medicaid, if you're wanting to see if you do qualify for Medicaid services, or your child that has a potential SED would qualify, you would go through Medicaid's independent assessor, and we'll be providing that number, I believe, during this webinar, which is currently Liberty Healthcare. So they would complete a face-to-face functional screening, as well as a CDA, which is a clinical screening. And using those two tools, they're going to identify whether or not the child would meet the criteria for SED. If they are found to be eligible through SED, then they would, Medicaid would gather additional information in regards to the income to see where the family fell in the federal poverty level. And if they are underneath the 300% threshold, they would become eligible for Medicaid services. And there are a couple of things that need to happen after that point. In regards to maintaining that eligibility, they would need to be rescreened on an annual basis, complete a person-centered plan, and continue to maintain that person-centered plan through their eligibility period. But once you're identified as being eligible, as long as you do those things, you have a year of eligibility for all Medicaid services.
So one of the things that you brought up is how does this work if a member does have private insurance? Mm-hmm. And then now, why would they, if they went through this whole process with Liberty and they were found to have a serious emotional disturbance, SED, mm-hmm. And you said CDA, that's a clinical diagnostic exam.
Correct.
So if they were found to have a serious emotional disturbance and functional impairment, and we were discussing beforehand the federal poverty limits, so 300% for a family of 2 is roughly $50,000, and for a family of 4 is about $75,000. Mm-hmm. So kind of important figures for families to keep in mind. But how then, then they qualify for Medicaid. How does that work if they have private insurance too? Who do they get to just select who gets to be billed for the service, or how does that?
That's a great question. And so Medicaid is a payer of last resort. So if there is a private insurance, a commercial plan with the family, that plan would be billed first. At that point, then the provider would then bill Medicaid. And what Medicaid is going to do is they're going to look and see what the private insurance paid. And if Medicaid's reimbursement rate is higher than that rate that was paid by the private plan, we would pay the difference up to that amount. And then the provider would not be able to bill the family. If the private insurance paid a higher rate, Medicaid would then not pay anything and the provider would then be satisfied.
So if a family has private insurance and Medicaid, and the private insurance plan goes to their deductible, then Medicaid picks that up to the Medicaid rate.
Correct.
And there's no bill for the family. So the family then doesn't have to pay their private network deductible. That's picked up by Medicaid.
Correct.
What is it the same if a service is non-covered? Like say they've met their limit for psychology or for a psychiatric treatment, or
in the event that there is a exhaustion of a benefit with the private insurance plan, then that primary insurance will be deemed as exhausted, and then Medicaid could be billed.
So is there any case when a member has private insurance and Medicaid that a family would get a bill from a provider?
The one that comes to mind is if there's a service that, like Wes was indicating, that there may be some work that needs to be done on the front end, like a prior authorization for a service. And if that's not obtained, that could potentially cause some concerns, because some services do need to be prior approved before they're rendered. So I can't think of a different example where someone would experience a bill. The one thing I would like to comment on is the copay amount. So there are some services like occupational therapy, some therapy visits, some hospital visits that are associated with a Medicaid copay of $3.65. And I want to check and verify as to whether or not individuals that do have private insurance will be charge that copay, and we can put that information out with this webinar. Again, I apologize, I don't have that information today, but I will get that, and we can put it out there. Additionally, there is a, would you like me to talk a little bit more about the folks that maybe don't have insurance? And
Absolutely, yep, I was going to transition to that
Okay.
next, so you're right in the lane there.
So in the event that someone goes through the Medicaid eligibility process and is determined to be Medicaid eligible because they have a child with SCD, they would be subject to a premium if they fall between the 150% poverty level and the 350% poverty level. Now, that premium would only be associated with those individuals who do not have private insurance as a primary coverage. If you have primary coverage, you will not be subject to that premium. But if Medicaid acts as the primary, there will be a 5% premium, monthly premium, based off of your countable income. So it's not the total income. The countable income it has some deductions that are taken into consideration that really kind of drill down. One of them is the standard IRS deduction. There's a housing deduction and a child deduction for childcare, excuse me. So those things would be taken into consideration and deducted from the actual annual income and then divided by 12 for the number of months. And then that 5% of that amount would be subject to the family to continue the Medicaid eligibility process. Now, it's 5% is the maximum out of pocket for anybody who's Medicaid eligibility. So if you have more than one child that is meeting that SCD criteria and determined to be Medicaid eligible, and your family falls between that 150% and 300% FPL, then it would just be 5% for that family, not 10%.
So it could be multiple kids if you have.
Correct,
multiple
yes.
kids in that situation. And is there the amount that you would pay? So talking about families now who don't have private insurance, because we've already determined if you have private insurance and Medicaid, you don't have to pay that kind of premium.
Correct.
So families that don't have private insurance, then we were talking before about you might have a copay or a coinsurance for any of this for services as they're rendered as well, or is that not?
Well, I'd like to make a correction really quickly. I apologize. So the 5% premium associated with eligibility for Medicaid is actually between 186% up to 300%.
Okay.
So there's 3 tiers. So if you're below 150%, you are not assessed any type of premium.
So there's no cost for and
No.
you have the same access as everybody up to 300%.
Correct. If you are between the 151 and 185, it's a $15 flat rate per child. Per month. And if you're above the 185, that's when the 5% comes in. So it goes from no premium to a $15 premium to a 5% premium of income.
Okay, and so that's your premium, is there any cost associated with any service that you get other than maybe this $3 and something cent?
No, that's the only copay that is associated with those specific visits. Like I said, it's some different therapeutic visits, hospital-based visits, some outpatient clinic visits, physician visits. So it's up to the provider to collect that at time of service.
So that would be the only bill that you would receive from a provider, would be these particular co-pays that are involved in that particular type of service.
Correct.
Other than that, you shouldn't ever expect to get a bill from your provider.
Yes, and like I said, I can't think of any unique circumstances, but perfect world, yes, you should not be receiving additional charges from your provider.
Okay, and if a provider recommends a service that is not covered, and they know it's not covered under the Medicaid plan, that's something they would have to discuss with you prior to you receiving those services in order for them to bill you. Is that correct?
Great. There's another transition here. So if in the event that there's a service that's not covered by Medicaid here in Idaho, so it's not part of our state plan, for individuals that are Medicaid eligible and under the age of 21, they can access any medically necessary service through either their EPSDT benefits. So early periodic screening, diagnostic, and treatment. That is an avenue for individuals within Idaho and every other state. This is a mandate through CFR, so Code of Federal Regulations, to provide access to medically necessary services to children. And again, children is classified as being under the age of 21. So folks would have access to this service if they're currently Medicaid eligible up to the last day in the month they turn 21. So in the event that there was a service identified that is not part of the state plan, so it's not traditionally reimbursed, then there is a process to request that service, and it's just looked at through utilization management process where we are having an expert in that area, whatever that service may be, review the clinical documentation to determine if that service is actually medically necessary and will correct or ameliorate the condition of the child.
And how does a family go about applying for that? Like if they need to go to an EPSDT, what does the basic process look like for them?
So the process would be so if we're talking, staying in the substance abuse and mental health arena, if it's an outpatient service, it would be requested through Optum, the Idaho Behavioral Health Plan. If it's a residential service, then it would come directly through my department. And what that process entails is just the parent would initiate a document that would identify the service. They would work with their provider or specialist to support the need for that service and potentially supply some additional clinical information that would substantiate the request for that service.
Okay. And families too, if an EPSDT process is something you need to go to, the Idaho Federation of Families also has help here for you to be able to talk to someone who's been through the process before and kind of walk you through that. So it's not something that you have to do blind.
Yep, and it's a great process. We've been trying to educate families, providers about the logistical operations in regards to how those services can be obtained. And again, it's outside of the traditional package of services. So if there's something that again is evidence-based and supported, but just not available through the network, then we can try to obtain that service for that child. So it's a great way to try to address some of the needs of these kids in Idaho.
Yeah, very important, especially as you get into some of the regions that don't have as many providers, and you do have children that have the same needs in those areas as other places. So.
Because just to comment kind of on what Wes was indicating in regards to those special agreements, if there is a provider that does administer one of those services that is not part of the state plan, we can do a single case agreement with that provider and pay them maybe a different rate that would entice them to provide services for the Medicaid individual. So that's one of the things that we can do, or Optum, the Idaho Behavioral Health Plan has done it. So again, if there is a provider in the area that's just not contracted with Medicaid, then we can try to work out a single case agreement for that unique circumstance.
And this is still done through the EPSDT process.
Correct, yes.
Okay, great. Well, I appreciate that. If a family has questions about their services or their supports or their bills, is there a particular place that you prefer they call? I think we put up a Medicaid line, a number at the end for questions about that. But.
Sure. Yeah. If there's questions about behavioral health benefits, substance use disorder, they can call the Optum member line. I'm not sure if we're going to post that number, but it'd be great if we could get that up there. So again, Optum, the Idaho, oversees the Idaho Behavioral Health Plan, which administers all the outpatient Medicaid behavioral health services. So, or 95% of them. So they can be, a clinician can be reached right away through the member line and talk about services that are available in your community or that you may need and provide referrals, et cetera. So I would probably start there. And if it's a conversation in regards to residential treatment or psychiatric residential treatment, then I myself or my staff could be available to talk with the family and help guide through that process and establish access if that's needed.
Great. And again, families too, if you have questions and you just don't know the right place to call, you can call the Idaho Federation of Families and they'll help you figure out who the right person to talk to and all that. So I know I had some more questions for you, and they've gone from my mind, so I'll come back to those. But we'll let Jamie have a shot here. So Jamie, you work for the Division of Behavioral Health, and my understanding, really, this is kind of a new area for me, not one that I've had that much experience in, but you all provide services for children who have serious emotional disturbances. But my understanding is this is for children who are really outside of more traditional insurance. So they might not have private insurance or Medicaid. They wouldn't necessarily be eligible for each or may fall outside having this. Is that correct?
Thanks, Janet. We actually, we provide services to anyone as long as they meet our priority population. So I can talk a bit about that and then talk a bit about our billing if that works for you. Okay. So the Division of Behavioral Health, we serve children, families, and adults, but I'll focus on our children's program for today. So to receive services from us, you have to have a child who's under the age of 18. And then if you have a transition age youth, so someone who's a child who's getting ready to age out, terms that families might hear a lot, then we also provide adult mental health services. for those transition age youth as well. But you have to have a child under the age of 18, and they have to be diagnosed with a serious emotional disturbance. So we've talked a bit about that today. It's kind of a scary term, I think, for families. It's more of a medical or clinical term that we use to classify kids to understand, what's going on with them in their life. But basically, they have to have a diagnosis from the DSM, and they have to have functional impairment. And that's now we use the CANS assessment to determine a child's functional impairment. So
I just stop you just for a second. DSM is a diagnostic manual, so it's the big book that they go to that has all the codes.
Yes, thank you. So you have to have a CD diagnosis, and you have to be under 18, and you need to be a resident of Idaho. So the state law around our services, those are the three things you have to do to be able to receive services from the Division of Behavioral Health. We do some crisis services. So if a family's in crisis and they call the Division of Behavioral Health, we have 24-hour crisis line will help connect families to where they need to be. If families show up in the emergency department with a child with a mental health crisis, depending on where you live. So again, if it's a rural area, this might be more of over the phone crisis connections, but here in the Treasure Valley, we would deploy a clinician to the emergency department to help the family navigate some of the resources depending on where you live. So we do some crisis services in that way. And then we also do court-ordered services. So if your child ends up in the juvenile justice system and they have maybe the judge is thinking they might have a mental health diagnosis, or it's already known that the child has a mental health diagnosis, often they'll come to our division for services. So we would do assessment and treatment planning and some services under the court order. And then we also have, kind of our catch-all category, which is voluntary. So any family can come to us with any need, and they can meet with one of our clinicians and have an assessment, and we could talk about what our division could do, what they already have. So if they already have commercial insurance, if they already have Medicaid, and what services the family already has potentially through the school, and then where our division may be able to fill in some of the gaps that aren't covered anywhere else.
And
was there a question, maybe?
There is. What happens to Medicaid eligibility when a child turns 18?
That's a great
There's
question.
a loaded question.
It
Yeah, I
depends.
can't answer that one. I'm gonna just look right at David.
So that depends. Sometimes when a child turns 18 years old, if they're out of state foster placement, they may lose their Medicaid eligibility. However, traditionally in Idaho, Medicaid goes up through the end of the month of the 19th birthday. So hopefully that would be the circumstance. And some Idaho foster kids can actually have Medicaid beyond that 19th birthday as well. So the answer to that question is really, it just depends on the circumstances. We would, if there is a specific circumstance, we just ask you that you reach out to our self-reliance department that oversees all the eligibility for Medicaid and inquire in regards to eligibility termination, and therefore appropriate steps can be taken to try to extend that eligibility or ensure that there's a transition to another potential insurer.
And this is a very complicated question. There are so many, and this is something that I learned, there's so many different ways to have Medicaid. I have a daughter with a disability. She had Medicaid through the Katie Beckett waiver. That's a different circumstance than someone has it through adoption or through foster care or through foster care or adoption from another state or income-based. So there are a lot of caveats to that question. So, and David's right, it really does depend.
The one specific circumstance that may be applicable to our discussion today, excuse me, is if a child was eligible through this program, this Youth Empowerment Services program, they would be eligible up into the end of the month of their 18th birthday, if that's the only way that they're eligible. So if they were above the 185% up to the 300%, they would have services up through the end of the month of their 18th birthday. Now, hopefully that there should be transition planning going on during that whole time with the provider, with the folks at Medicaid, to ensure that that individual will be supported as an adult after they were to potentially lose Medicaid eligibility. So this program, the authority that we've opted in for to be able to support the Youth Empowerment Services program at Medicaid, our eligibility group stops at 18 years of age. So That's unfortunate, but that's the way that the program has been outlined. And in the event that an individual were to be potentially eligible underneath that 185, they would just roll out of this Youth Empowerment Services program, and then they would become part of their regular eligibility group. So if they were a CHIP kid potentially, or if they were just qualified under basic Medicaid, they would just fall back to that eligibility group. And the only thing that they would lose in that sense would be the service, would be respite.
And let me just add something that you've mentioned. This is such a great program for those up to the federal income level of 300%, as you mentioned. I want to mention, especially for those that age off, all these individuals, especially if they don't have insurance, may be eligible for a pretty strong tax subsidy or tax credit through the Idaho exchange, right? So Idaho commercial insurance, children are covered up through age 25, usually up to age 26. And so in these cases where they roll off of Medicaid, it'd be if a family hasn't already looked to see if they qualify for a tax credit and are able to get reduced cost insurance, I think that's a great option. And
yes.
Hopefully they've done it in the past, but if they haven't and they're losing Medicaid, definitely check out that, because the tax credit goes all the way to 400% of the federal poverty level. So even a broader group of people may be eligible to get commercial insurance through Your Health Idaho and the Idaho Health Exchange.
Which is perfect. And then again, that whole discussion we had about deductibles and out of pocket, that would be then applicable to those kids, where
Exactly.
not so much with the Medicaid. But also they brought up, and David in his response brought up those transition services. So kids that are potentially aging out and losing their Medicaid, then back to DBH in terms of potentially transition type health there.
Yes, right now our clinicians statewide, we provide kind of a catch-all of services, both clinical and non-clinical. So we have, we do assessment and we do diagnostics and treatment planning. We do some medication management. We have contract prescribers, not always a psychiatrist. Those are hard to find throughout Idaho, but we usually have maybe a psychiatric nurse practitioner, for example, that we would contract with for medication assistance if families weren't able to get it in the community. We do case management, intensive care coordination. Right now, we're bringing on wraparound. So we have wraparound available, a very small scale. Wraparound is a large part of the YES program. And so as the YES program evolves, the Division of Behavioral Health, what we do will actually evolve. So what I'm telling you that we do is what we do today. But a year from now, it might look very different. We'd have to have another webinar, I think, to update you all. But so we're doing some wraparound. We do parenting with love and limits. And then we do some just regular psychotherapy. So depending on where you live and what you need, our clinicians will try to fill in those gaps.
And one comment is, that I know that Jamie and I work really closely together, and her staff and my staff. So I think that that's imperative, that when we're working on these transitions, sometimes, Jamie's team has a case open in one of the regions and our team is working on a case. So we really try to collaborate as much as possible to ensure that, everyone's working toward the same goal for that child.
Right. So I can talk a bit about eligibility, Janet, for our program. I talked about eligibility, but I'll talk a bit about what it costs. So
okay, just 1 second.
Oh,
Here
yeah,
we
go
have
ahead.
a little message. We are doing some polling during this webinar, so please go ahead and participate in that as we go along, and do send in your questions if you have them. We should have a little time here to answer some questions. So.
Thank you. So basically, when a family comes to the Division of Behavioral Health, they would complete an application for services. And part of the application is a fee determination process. So very similar to what was already talked about today, we would be asking you what's your gross annual income. There are deductions we take, similar to what David talked about, child care, for example. So any of the federal deductions that are allowable, we would take those off the top, if you will. And then we have basically a sliding fee scale that, depending on your income, depends on how much you pay. So if you are over 300% FPL, again, which was around $75,000 for a family of 4, and that is with the deductions, I think we should point out, then you right now in with our services, you would pay 100% of the cost. So for example, if we provided you with psychotherapy and it was $55 an hour, then you would be billed $55 in today's setup. We also have a 5% cap on the gross annual income. So if you were, your gross annual income was, I don't know, I'm not a good mathematician, I'm a social worker. Let's say it was, the cap was $100 and you paid your $100, then we would not bill you again for the year. So there is a cap with our services also for families who end up paying a higher out of pocket than depending on your annual income.
So very similar to an out-of-pocket max with primary insurance,
Yes.
where if, you receive psychotherapy weekly and you hit that 5% in March, you could continue to receive psychotherapy the rest of the year without cost to you.
Right. And so we also provide some residential services for families, depending on, their commercial insurance. Maybe they've hit the maximum benefit for residential, or it's not necessarily going to meet the medical necessity component of Medicaid, or the family isn't Medicaid eligible. So we do provide some of those services, and we're changing the way that billing happens. We have some legislation this upcoming legislative session. Currently today, if your child went through residential placement, which is voluntary, but through our division, you would go through child support to recoup some funds to basically pay your cost share. And we're changing that so that families wouldn't have to have like a child support action opened for them. So we're changing that this legislative session, hopefully. And that will be, it will be much better for families. So we're pretty excited. We're hoping that we can make those changes this year.
So you brought up one thing about the deductions, and we talked about that earlier about the 300% being roughly $75,000, and there is a difference between the 300% qualification and the deductions that they take from your gross income to qualify versus for the cost share that the families have, the premium that families have. Correct? Can you address that a little bit?
Correct. So if during the application process, all of your income would be collected for eligibility determination for Medicaid. Now, at that point, they're going to identify where you are in that federal poverty level. And again, for eligibility to the Youth Empowerment Services Program, it's going to be underneath the 300% cap. Now, that information is then obtained, and we look at that, and we then say, okay, well, if the income used to determine that the federal poverty level designation, we then, if you're between that 185 and 300%, we're going to take those deductions off of that. So again, it's an IRS standard deduction, pending how many parents are in the household. I think it's 12,000 or 24,000. And then the remaining deduction is then divided in half for other expenses. And then we apply the child credit for childcare. So, and it's I think $200 per child. And at that point, we're going to look at that number there and determine what the 5% would be for the monthly premium. Now, there will be an application process for a hardship. So we are still working out the details on that. And we'll be providing information to those that are eligible in that category group as to how they could apply for a hardship if their expenses may exceed those standard deductions.
And when does that take effect? Because I know we started off the ability for families to go through Liberty and qualify up to 300% this past January. But to my knowledge, so far, there hasn't been any premiums or anything that's happened so far.
That is correct. We are just in the final stages of finalizing everything, and we'll be rolling that out beginning of next year. One thing I would like to let everybody know is that we will be communicating, with everyone that again is eligible throughout for the Youth Empowerment Services Program, so they understand what those costs may be, as well as we are unable to charge someone a premium until 60 days after eligibility determination. So we're looking at the third month after, once we start the collection, we will be looking at the third month of their eligibility. They will be assessed that 5% premium.
And in the information that they get, there'll be information about how to apply for the hardship.
Correct. If they have questions, there will be contact information in there if they have questions, or if they do want to apply for the hardship, we'll definitely have information in that communication for that process.
Yeah, I know there have been all kinds of discussions about other things that might be qualifying expenses, other extreme medical expenses for other things, or caring for others, things like that. So I'm glad to hear that there's going to be further work done on that for that, and that families will know how to apply for that. Because I would encourage families, if if the premium does become a hardship for families and something that really does make it difficult, it is worth it to go through the application for the hardship. So
Absolutely.
nobody wants these kids to not receive services because of the cost of it.
And, just in regards to encouraging families to try to access these services, it's really important that regardless of whether you think you'll be qualified for Medicaid or not, I would never discourage a family for pursuing the independent assessment through Liberty Healthcare to determine whether or not their child may qualify as being SED, and then whether they have access to Medicaid services or not. At least we've identified something that we can try to figure out how whether it be DBH or Medicaid can figure out again how to engage that family in the appropriate care in their community. So if there's a chance that there may be that SED with one of your children, then I encourage you to call Liberty Healthcare and arrange that screening.
Yeah, I agree. This is something that's very important for families, that we want to make sure that we're identifying these children early and getting families the help that they need as early as possible so that we avoid crisis situations.
Absolutely.
We can literally get them into the system and provide the best care possible for them straight along the way. So again, if you all have any questions, we have a few minutes left here. You feel free to ask questions. Do any of you have questions or extra things that you thought of during the webinar that you thought might be beneficial to share with folks?
I will say when you come to the Division of Behavioral Health, we go over the fee determination form with you. And we also have a brochure, which you can find online today, that shows the average cost of our services. And so you would know before you had any services rendered from us, the cost that you would potentially be billed. I think it's important. You shouldn't be surprised anyway. And if you are, you should tell
I would
us.
just like to thank the Parents Unlimited Federations of Families for doing so much advocacy work and helping these families navigate the system, because it can be very challenging, and we appreciate all the work that they've been doing.
Well, and I think, Jamie, you brought up one thing that I forgot to mention before, is that the services that you all offer. So we had talked earlier about, the out-of-network rate and having a standard bill rate. So maybe psychotherapy, a therapist would bill at $100 an hour, and their contracted rate with an insurance company might be $80. Mm-hmm. But then a Medicaid rate for that same service, generally speaking, is less than what even a contracted rate with an insurance company would be. Right. And the Department of Behavioral Health tries to have some parity, some level of equality between the rates that you all are charging and the rates that Medicaid would charge. They aren't necessarily be exact, but it is reduced, and I think that's really important. And we do have a question.
How will Prop 2 affect access to mental health services?
That is a great question. And I think it will, so I'm really not prepared to answer that question.
I think Wes would answer that question.
I can try. I'm happy to take that.
So it's going to bring more people into eligibility, which will have access to.
It's a little bit outside of the discussion about children, because children already do have access to Medicaid from 0% of the federal poverty level all the way up to 185%, right?
Correct.
And Prop 2 is filling in the coverage gap that exists primarily for adults, for non-children, between 100% of the federal poverty level, between 0 federal poverty level and 100% of the federal poverty level. Right now, once a family with, of course, adults, we're talking about adults under Prop 2, has 100% of the federal poverty level, they are able to go to Your Health Idaho, as we described right now, for 2018, and get a pretty strong tax credit to make the health insurance affordable. What Prop 2 would do, and so if they do that and they have commercial insurance, of course, they have access to mental health for their family. Prop 2 would fill in the gap and say for those that are below 100% of federal poverty level, instead of not having access to either Medicare or commercial insurance, they would have that Medicaid or commercial insurance. They would have the option to go to Medicaid for all services, not just mental health.
Correct.
So currently there is that gap of adults below 100% of the federal poverty level, and Prop 2 would give them access to mental health and other conditions through Medicaid.
That is correct, yes.
Makes sense.
Any other questions come through for us? All right, well, I just want to take a moment and thank you all for coming. I really appreciate you all sharing your expertise with families and helping them all understand what's an issue. I'm sorry?
The contact information.
Yes, please do. we'll have the contact information for Medicaid, for Liberty, and for the Department of Insurance up for you all on the webinar here. So that'll give you that contact information and the number of the Idaho Federation of Families. I don't know if we put that on there, but it's easy to find if you do just a regular Google search on Federation of Families. So thank you all, appreciate it.
Thank you.
So I'm just gonna jump in on West, just to
Sure.
make sure that next Tuesday is election day, everybody go out and vote. Don't forget, it's an important election day.
It is.
Yeah, and just kind of doing what Janet has said, we definitely appreciate the expertise coming. It's a really complicated issue. So even if it's just, kind of touching the top of some of the questions parents may have, that hopefully there's a lot that they can pull from, go back and watch it again if you need to. It will be archived. We will have this book on the Federation website. It's also on the Yes, the Youth Empowerment website. So if you've got questions, you weren't really sure what made them say on something in particular, go back, look again, send it to family members. So next month, going into November, we also will have another webinar. This one is looking at child serving agencies and kind of who does what. And so our favorite facilitator, Janet, will be back talking to Juvenile Justice, the State Department of Education. I'm back with Behavioral Health and the Yes Project. And I feel like I'm missing somebody. There's one more there. But yeah, come back. And that's kind of, again, an overview of if you have a child that does have an SED, what role are they playing? Because we have a lot of different child support agencies that are touching the kids. And sometimes it's complicated to understand, how do you navigate those services. So thank you again.
Thank you.
Thank you.
Thank you.
Pleasure.